somebody
Okay.
who.
So tell me about some of the recent patients that you've helped that could have had amputation or worse things happen.
So we've had several opportunities to see some complex wounds, especially in diabetics, and we've had several patients recently who we've been able to treat aggressively initially, and with minimal debridement, minimal surgical treatment, get them over their infections without having to have an amputation. So we've been very pleased, especially as of late. So.
How do you know, like, if people are on the brink of it? Do you just you just know there's enough salvageable cells left, or?
It's kind of a global observation of how they're doing clinically, whether their infections are controlled, whether their lab work is stable, and whether or not we're able to see improvement from and limiting ongoing tissue loss. So that's why we see patients so frequently sometimes, especially initially, is we need to make sure that we can get any infections under control and get patients treated quickly with antibiotics, which many times we're able to do as an outpatient, and keep them out of the inpatient setting in the hospital and keep them at home as much as possible while treating these complex issues. And so those one of the many benefits of us taking care of doing what we do in this area. So.
Great. Anything else, Warren?
What was there was something else?
Oh,
right,
yes.
yeah.
To talk about ostomies, how does that relate to wound care?
So we have many patients in the community who have had intestinal surgery who require temporary to permanent ostomies, and we have nurses who are specially trained to deal with many of the complications and issues that come with having an ostomy and an ostomy appliance. And so we are well versed in how to handle those problems, and so that's certainly an issue that we help people with, in the patients in the community with frequency. So.
Yeah, I just was actually in the nurse orientation on Monday for the wound care. I learned a lot, and thankfully didn't have a very heavy breakfast that morning. But they were talking about people who come in with gunshot wounds, and they have to figure out how to use the not so permanent ostomy bags.
Mm-hmm.
What's the difference between having something that's permanent and something that's just for a couple of weeks or so?
Well, it depends on the underlying issue that caused you to get a colostomy. Sometimes people come in with emergency that need an emergency operation, who just need a temporary ostomy until they heal, versus some people who come in with certain kinds of colon and rectal cancer who require something permanent. And thankfully, especially for those patients who have to have permanent ostomies, you can wind up with lifelong issues, especially with skin breakdown around the stoma, and we have great nurses who are able to troubleshoot those problems well, and keep people from having their to keep people from having minimal problems in that area. So
Also, psychology too, right? Because they kind of don't really want to accept that they're going to have that issue the rest of your life. How do you approach patients and kind of getting them to understand of why this is happening to them?
Well, it's certainly a difficult discussion to have with some people, but again, sometimes, certainly in certain emergency situations, we don't really have, that luxury, but it's something that we, approach patients with and say, look, we've got plenty of ancillary services, including wound care, that's going to help you be able to live with this without, with minimal impact on you downstream, and to keep people, there are many patients that we have who have, permanent ostomies, and they live basically normal lives. So, and we're able to help facilitate that. So.
Very good. Anything else?
Gonna head up and do some Mozart stuff?
Okay.